doctors, Dr.MedEx Indian Medical Society is going to explain few important points related with lungs. That is lung volume. It's very important. Yes, as you know, whenever you are going to run, doing jogging, running, your lungs are very important. It plays an important role for human beings as well as animal kingdom. Okay, so this is very important point. Very important point. First of all, we are going to study few important points about the human lung anatomy. Okay, human lung anatomy. Yes, diagram of human lungs. Okay, so this is larynx, trachea. This is the right main stem bronchus, left main stem bronchus. This is bronchioles, right lobes. Okay, right lobes, three lobes, 1, 2, 3. Right side, three lobes, and left side, left lobe, left side, two lobe, left side, two lobe. Okay, so this is one, this is two lobes. Okay, so this is right lung and this is left lung. And in this picture, you can see this picture. This is alveoli, and this is very important part. It plays important role in the respiration. That is diaphragm. This is left lobe. This is right. You can see here clearly 1, 2, 3. Right side 3 and left side 1, 2. Okay, left side 2. This is as you know the right main stem bronchus, left main stem bronchus. This is bronchiole. This is trachea. This is very important. Everyone know this. Okay, come to here. In this picture, thyroid cartilage is here. Trachea. This is called trachea. Trachea is here. Apex of the lung. You should know the landmark. Apex of the lung. This is right lobe. This is left side, upper lobe. This is called hilum. Okay, right bronchus. Okay, horizontal fissure. This is known as fissure. Horizontal fissure. See, it's horizontal, and this is oblique fissure. Fissure means it's a segment, type of segment. And see here, this is oblique fissure in the right side. Okay, these are the bronchioles, left lower lobe and base of the lung. This is base. This is apex. Okay, this is why it happens like this. This is cardiac notch. Okay, come to here. This picture is very clear. Trachea, left bronchi. These are left bronchi, right bronchi, right bronchi. This is bronchioles. A small terminal part is the bronchioles. Right lung, left lung. Come to the. This is very important picture. As you know that static lung volumes and capacities. Static lung volumes and capacities are measure of air in lungs at different points of the respiratory cycle, measured when airflow is not occurring at rest or at a specific fixed level of inflammation or deflation. They are subdivided into 4 standard volumes and 4 capacities, each with physiological and clinical role. Okay, so the tidal volume, 4 static volumes. First of all, this is you can see this, you can see the you can see tidal volume. You can say this tidal volume. Okay, tidal volume. So tidal volume is approximate. Come here. Tidal volume. Okay, tidal volume is approximately how much? Yes, please tell me. Tidal volume is how much? Yes, you are right. Tidal volume is 500. Tidal volume is 500 ml. Okay, tidal volume 500 ml. Inspiratory reserve volume. Okay, that is approximate. I'm telling to you, approximate 2000 ml. It can be 2 to 3000. Okay, approximate. And first, second, third, ERV, that is expiratory reserve volume. Expiratory reserve volume is approximately 1000 milliliter ERV. Okay, reserve volume. Okay, residual volume, that is residual volume, not reserve, residual volume. Fourth is residual volume. Okay, residual volume how much? 1300 milliliter. Okay, so we can say that tidal volume is 500. Tidal volume is 500. Okay, this tidal volume is 500. Tidal volume is 500. Volume of inhaled or exhaled during normal quiet breathing. Okay, exhaled or inhaled. Okay, exhaled or inhaled. That is 500. Inspiratory, IRV, inspiratory reserve volume, additional volume of the air that can be forcibly inhaled after the normal tidal inspiration. That is, normally average is 2000 to 3000 milliliter. Okay, what is ERV? ERV, additional volume of the air that can be forcibly exhaled, taken out after a normal tidal expiration. Okay, average is, it depends. Okay, approximate average is 700 to 1200. Okay, 7 to, you can say, 12 milliliter. Approximate, I'm telling approximate. This is approximate. Residual is 13. Okay, residual is 13. So I'm telling to you few important things. Static lung capacities, static lung capacities, static lung capacities. Okay, static lung capacities. That is IC equal to TV plus IRV. Okay, VC equal to TV plus IRV plus ERV. Okay, FRC equal to RV plus ERV. Okay, come to the final point. This is a final point. Okay, final point is TLC, total lung capacity, is equal to TV plus IRV plus ERV plus RV. Okay, plus RV. Okay, plus RV. So this is a very important point. Okay, this is very, very important point. Okay, yeah, you have to remember it. Okay, come to here. Tidal volume. I told you already. Tidal volume. So tidal volume. This volume is approximate. This volume is approximate 500 milliliter. Tidal volume. Whenever very quietly you are taking the respiration, tidal volume 500. IRV 2000. This is from normal, normal. This is IRV. Okay, how much? IRV how much? 2000 ml. Okay, IRV. ERV, this is ERV. How much? ERV? Yes, please tell me. Yes, only 100 ml. Okay, tidal volume 500, IRV 2000 milliliter, ERV 1000. Residual volume, this is called residual volume. Okay, this is called residual volume. Residual volume how much? Residual volume how much? This is residual volume. Yeah. 1300 milliliter. Okay. Sometimes they ask question, what is FRC? Okay. So recently I told you FRC. Okay. FRC come. What is, yeah, this point FRC, this is also a question. All are questions. Okay. Sometimes they will ask you IC, sometimes they will ask you this VC, sometimes FRC, sometimes they will ask you TLC. Okay. So FRC equal to, come to the picture, FRC, this FRC, see, FRC, okay, FRC, I can say residual plus RV, RV plus ERV, okay, RV is how much? 1300 and ERV equal to 1000, so you can add and this is the answer. So they ask directly in the exam, no need to panic, okay. This is called vital capacity. From top to bottom, this is vital capacity. This is 0. This is X. That is here. This side is the time. And this side is volume. Volume. Okay? Yeah. Yes, I have already explained you that this is inspiratory. This is the tidal volume. Inspiratory capacity. In inspiratory capacity, you can add inspiratory plus tidal volume. This is expiratory reserve volume. This is functional residual volume. Just now I told you functional residual volume. ERV plus RV. ERV plus RV, total line capacities, we can add all. Total line capacities, we can add total line capacity TLC. We can add all. Total lung capacity, we can add all. In total lung capacity, see here, total lung capacity. Total lung capacity. Total lung capacity, how we can say? TV plus IRV plus ERV plus RV. Okay, so this is called total lung capacity. Okay, so this is all. This is all about. So I'm telling to you one very important thing. So now we have the four static lung volumes: tidal volumes, inspiratory reserve, expiratory reserve volume, and residual volumes. Okay. So four main lung capacities, that is inspiratory lung capacities, four main lung capacities, four main lung capacities. Okay, four main lung capacities. What is first one? That is IC. IC, inspiratory capacity. Inspiratory capacity, that is IC equal to TB plus IRB. Okay. Which one is the second one? Second one is FRC. FRC is functional residual capacity. Okay, capacity. So FRC equal to not IE. This is functional residual capacity. So ERV plus RV. This is also a question. Okay, FMG exam and NEET-PG. So which one is the third one? Okay, third one. Here is third one. Okay, vital capacity. Vital capacity represented by VC. Okay, so VC equal to TV plus IRV, IRV plus ERV, ERV. Okay, this is vital capacity. Okay, this is vital capacity. So what is the next one after vital capacity? Total lung capacity. Okay, here is the total lung capacity. Total lung capacity. Okay, so in total lung capacity, what you can do in TLC, total lung capacity, this is TV plus inspiratory reserve volume plus ERV, ERV plus RV. Okay, average on an average, okay, on an average, how much? 5 to 6 liter. Okay, in the healthy adult male and is relatively fixed for a given individual. Clinical relevance of the static volume and capacities. Okay, clinical relevance. What is clinical relevance? What is the important clinical relevance? Come to the clinical relevance. I'm telling to you. Just I'm telling to you. Yes, clinical relevance. Obstructive lung disease, that is COPD, asthma, RV increases and FRC also increases. TLC may be normal or increases. VLC and IC often reduced. In restrictive disease, ILD and chest wall deformities, TLC total lung capacities, TLC decreases, vital capacity also decreases, FRC also decreases, RV may be normal or slightly decreased. Okay, so how to measure the lung volumes? How to measure the lung volumes? Okay, so most common method to use this lung volume or capacity lung volume is helium dilution method. Helium dilution method. Second one is nitrogen washout method. Third one is body plethysmography. That is best. Body plethysmography is best. Also, we can say also the another one is spirometry. Spirometry, especially for spirometry. Spirometry, especially for VC. Spirometry, especially for VC. Thank you very much. Have a nice time. Thanks a lot. We can continue again another small topic. Thanks a lot. Okay. Have a nice time.